Good afternoon. So today we'll be talking about your medications you're going to be discharged with. If you have any questions, feel free to ask. The medication we'll be talking about is nitroglycerin, also known as nitrostat. What this does for your heart is that it decreases the workload that's placed on your heart, as well as increases the size of the vasculature so that your heart can receive more oxygen. The reason why you're taking it is for your chronic angina, which is caused by the lack of oxygen your heart is getting, generally due to exertion or activity. Some common side effects that you may receive while taking this medication are headache, flushing, dizziness, tachycardia or high heart rate, palpitations, nausea, vomiting, hypotension or low blood pressure. You may begin to sweat or develop a rash. Alright, some interactions with this medication with other substances. Firstly, you need to avoid any and all alcohol. This can potentiate and make worse the side effects, especially of hypotension. Other medications that can also increase the effects of this medication will be beta blockers, diuretics, or otherwise known as water pills, antihypertensives, calcium channel blockers, and aspirin. Another really important medication we'll talk about a little bit more is called sildenafil. It's important because you are already prescribed sildenafil for your erectile dysfunction. Another name for it is Viagra. But we'll talk about that a little more in just a minute. Something else that we need to talk about is how you're supposed to take and store this medication. So these medications come in little dark bottles, and they're that way for a specific reason. These medications need to avoid sunlight as well as heat and moisture. So it's always important to store them in a dry, cool place and out of the sun. Alright? The way you take it is sublingually, which you take the 0.4 milligram tablet and place it under your tongue and let it dissolve. Do not chew it and do not swallow it. Just let it dissolve until it's all gone. Something that's very important, if you develop syncope or have a fainting spell, it's important to call a medical provider immediately. Another important time to call 911 or seek medical help is if you are having chest pain and it has not been alleviated by 3 separate doses within 15 minutes. Seek immediate medical attention if this occurs. And again, we're going to go back, like I said, talk about the sildenafil, or otherwise known as Viagra. This is an extremely important information to talk about because sildenafil in combination can cause severe deadly hypotension, otherwise low blood pressure. And if taken together or within a certain time period, generally 72 hours, these medications can cause your blood pressure to drop, and emergency providers may not be able to bring back up your blood pressure, causing a fatality. Alright, so it's always important to speak with your provider about whether or not you've taken any sildenafil prior to being administered nitroglycerin. Also, if you're in the back of the ambulance or in the emergency department and they ask you if you've had it, please be open and let them know if you've taken sildenafil. Because if you do let them know, they'll most likely hold the nitroglycerin or be more cautious when giving it, or try other ways to alleviate your chest pain. Alright? And if you have any questions, please let me know. Thank you.